They're called COVID long haulers, those who deal with the effects of COVID-19 for many months. The National Institutes of Health awarded nearly $470 million to build a nationwide study on the long-term effects of COVID-19. Cronkite News reporter Nicole Long explains who can participate and how the study will benefit future generations.
Enrollment for the NIH Recover Initiative began earlier this month and includes over 200 research clinical sites across the country. Sabrina Shaw is no stranger to COVID-19.
The first time I had COVID was in May of 2020. It was about the middle of the month, and I was asymptomatic at that time. I did develop mild cold symptoms after I recovered from that, and then at the end of July, I was hit with a much more severe infection.
Her long-term COVID symptoms have turned into another condition, known as antiphospholipid syndrome.
And that blood clotting disorder is one where we actually have an issue where you've been fighting an infection, and that's how you develop it. So my neurologist and hematologist both believe that it's from COVID.
Shaw is already involved in a long COVID study, but is willing to participate in the NIH Recover Initiative.
Any opportunity that there are to help with research projects, I definitely want to do. So anything like that, I would certainly be interested in.
The study includes adults, pregnant women, and children, with the hope that the data found can give answers to the remaining questions about COVID-19 through clinical information, lab tests, and looks at different stages of recovery.
The study is a really ambitious project. Given the fact that it's such an impact on the U.S. health, we think that we need to look long-term as well as try and develop some treatments for the people who are suffering now.
Shaw continues to battle her symptoms, but has learned that not every day has to be a bad one.
As far as how I feel, I think, it's easy to say some days defeated and other days, just trying to really live in the moment.
The study's goal is to look into the long-term effects of COVID-19, the range of symptoms, underlying causes, risk factors, outcomes, and potential strategies for treatment and prevention. In the studio, Nicole Long, Cronkite News.